September is Prostate Cancer Awareness Month, or just Prostate Awareness Month. Now, men, if you're confused about the guidelines for screenings and treatments, we have answers for you. Here to make sense of it all is Dr. Mark Hong with Arizona State Urology, and it's especially important because early detection is always the key.
Yeah, that's probably the case with all cancers, but especially with prostate cancer, we're catching them early. There's been a lot of controversy about prostate cancer screening, meaning the PSA test. All I got to tell you right now, Javi, is the new guidelines tell us PSA is no longer a four-letter word. That means it's okay to screen for prostate cancer. There's been a lot of controversy about that.
There's always questions about the age. When should you start looking? What are the new guidelines?
Well, the sweet spot actually is going to be from age 55 to 69. However, if you're younger than that and you have some risk factors, such as your brother, your dad had prostate cancer, you definitely would want to get screened earlier if you're African American. So if you're at high risk, you might want to just discuss it with your physician.
Let's talk about the prostate itself, especially when it comes to biopsies. I was interested when you showed me that the prostate is actually about that size.
Yeah, well, you know, maybe not yours, Javi, but as you get older, that prostate gets bigger. So it's going to be about this size. And of course, this sits deep in your pelvis and it provides nutrients that go into your semen. But as you get older, it just causes problems. For example, it can develop cancer or get enlarged and choke off the urination.
You said the guidelines have changed when you're doing the biopsy specifically.
Well, the guidelines are the same on that, but we have newer ways of actually detecting the cancer now. So the way we have been doing it, and we still do it this way, is we actually take a prostate and we take multiple biopsies of the prostate by basically sticking it all over the place, meaning that we actually just sample a lot of places all over the prostate. And this is still a relevant way to do things. Nowadays, we also have some new techniques such as MRI-guided biopsy, where we actually do some imaging. So that's basically like if you were to take a prostate and imagine that you can actually see into the prostate where that blue area is, imagine if that's a piece of cancer, and then you actually were to biopsy by going directly into that area and sampling it, that would be pretty ideal as well. So now these techniques are much more advanced. We're offering those as well. So we do the standard biopsies, MRI fusion biopsies, and we can get more accurate on our biopsies.
Let's talk about the treatment because that's changing as well.
Yeah, of course. So we have a lot of new treatments now, especially some image-guided techniques. And all of that is just really a fast-moving field. And then let's not forget that in the world of the prostate, the most common thing is actually just an enlarged prostate, not necessarily even from cancer. So for that, we actually have a lot of new treatments. One of them is called the Urolift, U-R-O-L-I-F-T. They're small implants that we put in the prostate to sort of tent it open on the inside. And then also tried and true techniques such as the green light laser that opens up a channel by melting open a channel inside the prostate. Very minimally invasive ways to deal with this very common problem.
When you talk about the prostate screening, men, women, we all joke about it, right? When you hit that certain age and they go, oh, you're getting a prostate exam. It's really nothing to joke about. And again, if you are prepared, if you go through the screenings, you know, early detection, back to that, early detection is the key.
That's right. So the two things that we use to screen for, of course, is the PSA test, which is a blood test, and then, of course, the prostate exam. Now, having said that, it's a relatively quick way for us to really know what's going on, and then you make a decision with your physician about whether you need to go further on that or not.
All right, always great information. Thank you very much for displaying it so we all understand.
I'm going to put it back in my daughter's lunchbox now.